This is an employee healthcare. Sorry. Good morning, friends. My name is Pramod Bhuvan. I'm the director at insurancemanager.com. And today we are here to talk about our newly launched mobile app for employee health and wellness. It's an healthcare platform integrated with insurance, wellness, and healthcare all under one single roof. It gives me immense pleasure to host you for this webinar, and I welcome you all, the wonderful audience here. I will also be joined by my co-colleague, Mr. Prateek Shah, who also happens to be our head for employee benefit practice, and he will be taking us through the web portal live, right? So that we also give you the proof of concept, exactly how does this work. Thanks. Uh, we have branded the platform as Ensure My Team. As I told you, it's an employee healthcare platform. It comes with the HR portal and the employee portal, both on web-based and the mobile app. This aims to integrate insurance, wellness, and healthcare all under one single platform. As I take you further, I just want to give you a brief backdrop as to what prompted us to develop this app, what prompted us to spend so heavily on this technology platform. I would like to take you a few years back, as in 2-3 years back, even before the advent of the COVID. A lot of people had medical insurance policies which were lying in their emails or files. The awareness was quite low on what kind of covers they have. No one never even bothered to go into the policy wordings or coverage. But after the advent of the COVID, we have seen the awareness on the knowledge what they need to have on their insurance policies is the quotient is very high. We were flooded with queries from employees and also from the HR, wherein queries were coming. What is my cover under the policy? What are the kind of sublimits under the policy? Is there any deduction applicable in case of an hospitalization? And similarly, because the employees were raising queries, similar queries were also coming from the HR. So we thought of developing a platform on a cloud wherein employees and HRs can have easy access to this platform where they can view their policy related informations. What is the coverage under the policy? What is the claims process? Is there any sublimit or co-payment under the policy? The entire idea of doing all this was to ensure that there is a seamless communication and there's transparency on what is covered, what is not covered under the policy. The second aspect was the integration of the healthcare. What we have, so here is the slide, what we have tried. It is very difficult to put all our benefits under one offerings under the one single page, but we've tried our best to do that. So on the second aspect, which I told you about the healthcare and the wellness, what we have tried doing is, again here, during COVID, there were a lot of people skeptical to go to doctors for consultations. Sorry, doctors for consultations. Doctors for consultations. So here what we did is we integrated the doctor consultation on the app, wherein an employee have easy access to doctor-based consultations, and the doctors can give prescriptions which can be uploaded, which are uploaded on the app, and the pharmacy discounts
हाँ
can be
प्रतीक
also
सर
added.
हाँ
Sorry,
प्रतीक सर
Smita, can you mute yourselves, please? Thank you. So pharmacy discounts, health checkups can be integrated into the app. Similarly, you can also take a mental health wellness session. The other aspect was integrating wellness. Wellness we were doing before also, before the advent of the COVID, now we are also doing, but we have moved more to the virtual wellness platform. Why virtual wellness? Because again, here, the healthcare challenges of each individual employees were unique. Earlier, we used to do offsite wellness programs for employees, but someone had issues related to diabetes, someone wanted to listen about hypertension, some about skin, hair care, and so on and so forth. So it was not possible to arrange all these wellness sessions at the client location. So here we are engaging the discipline experts in those fields, like for example diabetes or hypertension or maternal care, and these people are coming on the platform, and we have got access wherein the employees get emailers related to the wellness workshops which we do. Once they register, they can come and view those wellness sessions online. So plus we have also integrated flexi policies. So normally employee insurance policies which are handled by HR or decided by HR have limited budgets, because these are these are policies which are sponsored by the organizations. But in case if the employee wishes to have an additional cover, for example an increase of sum insured or maybe a dependent cover, that also has been integrated on the platform. So this is also made available. So the entire objective was to bring on the entire healthcare under one single platform. So insurance, wellness and healthcare plus flexi policies integrated into one platform. So with this, I hand over the baton to my colleague Prateek Shah. Prateek will help us take us through the web portal live as to how does it work. And in fact, if you have any question and answers, please type in the chat box and we'll take it during the Q&A session at the end of the session. There will also be a poll which will be launched. Please participate. That will help us get feedbacks from you as to what better should be done, or what is your feedback on the current app which we are proposing. Over to you, Prateek. Thank you.
Yeah, thank you, Pramod sir. So I'll be sharing my screen. Yes, hi. I would request to all the participants to please attend this pool. Right. So hi, very good morning, everyone. And a very warm welcome to this webinar session. Okay, so we got the result, the poll results. So 78% people say this, the answer is all about the above. Okay. Right. So to start with, see, this is how the Insure My Team, the dashboard looks like. This is the HR dashboard. And we have given the option over here to switch it to employee mode also. So the whatever details in regards to that employee will be visible only, and not the all other details which normally HR wants. So this, if you just switch this thing, it will switch to employer mode. So we have a different tabs over here. This is a home page where all the details which are mentioned over here, where somewhere it's just a, I would say, a summary of each and every tabs over here. So if you see, we have a home tab. This is what it looks like. Then we have a members tab. The members tab will be give you a brief idea about your enrollment data, what is active count in the policy. And then there's a plan. The plans will brief you about the benefits in the policy, like what is the sum insured, what is the conditions in the policy, like room rent, maternity, and all other details will be available in the plans. Hospitals will give you an idea about your network hospitals, which are the hospitals which are under the network. Payments are something like for the endorsement thing. What are the endorsement which are processed? What is the CD status? What is the CD balance in the currently available in the policy for your further addition, deletion? And then the most important is the claim. So claims are what are the claims currently lodged in the policy? How much claims have been settled? What is the amount settled? So every details will be available in this step. So to start with, let us start with the members. So if you see, this is currently the policy what we have, a demo policy wherein it shows like what is the total count of people in the policy. So over here you can see the total count of policy is 106. Total count of lives in the policy currently are 106, out of which 28 are employees, 18 are spouse, 23 are children, and 37 other parents covered in the policy. This float balance will give you idea about a CD balance, like what is the amount currently available in the CD, which will help you to understand if any further addition happening, is that calculation is sufficient to take care of this particular endorsement. Over here you see these are the options wherein we are given you option to share you the health cards for your any emergency. If any employee calls up in sometimes like it's not available, his app is not working or something like that, the police calls you up. So you can share the cards from here itself by just clicking email card. So automatically this card will be shared to that particular employee as his number is already been registered into the policy. you have an option of addition of employee also. So if you just click that button, there will be a window opted, like one is for the single entry. So if something like newborn baby you need to add, or newly married spouse you need to add, you just have to put in a single entry. Or if there's a multiple employees you need to add with the families, you can put it in a bulk entry option. So this is how the enrollment process, active count of data is being shared over here. Next, if we go, we'll see there's a plan, like what are the policies which are onboarded into the policy. So you can see we have an option of onboarding health insurance, your group medical insurance, then you can onboard the group personal accident, and then simultaneously you can add a group term insurance also to this platform. So if you see, just put it down, it will give a, if I see the group medical insurance, it gives me a, for the HR, he can understand what is the grade we are given to the employees under this policy, and what is the hospitalization benefit, what is the covers, the maternity limit, room rent limit, and simultaneously you can see for the exclusion also what are the things which are not covered under the policy. So this will give also, if you want, you can download the policy if any, or for the audit purpose, if you need a policy at that point of time, it is very simple. You just have to click it and policy will be automatically downloaded to your system. So this is how it helps you to understand or take a decision, like for if you want to check like any covers you need to upgrade during the renewal, this tab will surely help you out. Next, we shift to hospitals. So if there's any emergency, if you want to check which are the hospital under the network of the insurance company, it's very simple. You just have to, we have given a search of 3 options to search. One is either you can search through your PIN code. So you can see if I put my PIN code, whatever the hospitals which are around my vicinity can be displayed over here. Second, you can see, you can share it, you can search through city wise, like if you just put a Mumbai, the entire Mumbai network hospital will be displayed. So if you want to share, you can just click it over here and automatically the hospital details will be shared to your mobile number. Third, you can see you have an option to search through name also. So if I put Kokilaben Hospital, so you can see automatically this has been shown that that hospital, particular hospital is under the network. So we have option of, we can search the hospital in 3 options, like either by name, by the city, or by the PIN code. For the next step, we go to payment. The payment will give you an idea about your endorsements, whatever the endorsement has been processed during the policy period. So you can see that there's a payment what we have made for the endorsement, and this is the endorsement details. You can download your endorsements copies also from here. Also, if you see the balance has been displayed over here, like what is the CD balance currently active in the policy, and simultaneously it will help you to take a decision whether that data what you're sharing for the process of endorsement has a sufficient balance in the CD account or not. If it is not there, you can always enhance that amount. Next is a very important thing, that is the claims. The claims, which is something which every employee or HR wants to understand. So you can see there's an entire claim statement which is available over here. So what is the count of claims which are registered? What are the status of those claims? Like either they are paid or under process, or if there is any query also, it will be displayed over here, and you can understand what query is pending from the employee side to process the claim amount. Also, most important, if there is any claim which is being settled, and if there's any deduction, so what are the reasons of the deductions? You can see all these details are available over in this session, in this tab. Sorry. So this is something which HR want. These are the major details which HR always want available with him. So this, what we do, we try to get all the things on this HR portal. Simultaneously, if we switch to employee mode, so details will be, endorsement detail won't be shared to him because it's not relevant for him to understand the endorsement details. So over here, for him, what is important is home. That is your policy, which is policy is active in the, currently active in the portal. The plans. Okay, that's one more poll has come in. So I would request you to please answer this poll. Right. So as I will be continuing, the results have also come. So what are the most common questions? So major questions normally the employees have is what is the benefits and the policy. Okay. So now we are moving towards the plan. So for the employee, what is important? Who are the members who are covered under the policy? So you can see this is something which details is shown over here. The employees, myself, my mom is covered under the policy. In case of emergency, I just have to click it and automatically my card will be downloaded and will help me to avail the cashless benefit. Next, you can see if there is a newborn baby or any new married spouse you need to add, you just have to, or maybe the correction is sometimes we've seen there is a correction required in the name or maybe in the gender. You just have to correct, fulfill the data over here and just upload the any PAN card or to authenticate that correction and automatically it will be routed to us and we will take care of that correction if needed. Second, I can see, I need to see what are the network hospitals. These are available over here. Again, the same thing, the same tabs, like either you can search by the name, by the city or by the PIN code and the claims. So you can see if the claims are also available over here. So what is the amount I have claimed? That was 34,512. The amount settled was 33,018. So this is how it gives me an entire synopsis of my claims, what has been uh, settled. Also, for any employee, if he needs any assistance sort of thing, you have an option of claim assistance number wherein there is a female Ashwini who takes care of the claim process. So if you have any queries, the spokesperson for that particular account will be displayed over here along with the mobile number. So if you have any doubts or queries, you can take it through and speak to them, dial the number, and these are not a toll-free number, these are direct numbers, and the spokesperson will be available around the time. Secondly, this is the same portal what we are displayed over here. The same thing is replicated to the mobile app also. So details and everything remains the same. So I'm through with my the presentation for the portal and in terms of employer mode and employee mode also. So I'll pass on the baton to my senior Pramod sir for take us to the wellness session. Thank you, sir. So I think we have got some questions also.
Right, thanks, Pradeep. There's a new poll which has been launched. This is related to the healthcare integration. What we have tried also doing is not only the user convenience, we have tried to integrate the primary layer of healthcare, which is the OPD benefit, also under the platform. So this platform is nothing but normally an insurance policy is serviced by an insurance broker, an insurance company, and the TPA who is involved. So with this platform, what we have tried doing is we have tried to integrate all these three service providers on a single platform so that for HRs it is convenience, for employees it is ease and transparency of all the communications. So, right, the poll results are also out. So as I told you, we integrated the new age benefits, which are doctor consultations, pharmacy discounts, health checkup discount packages, and virtual wellness sessions. So, and okay, the feedback is loud and clear that virtual wellness sessions are the need of the hour. Yes, yes, agreed very much. Okay, as we speak, I switch to the employee mode and I take you through these offerings. So I go to the teleconsultation, which is the video consultation. As I told you, all the employees have access to GP consultation here free of cost. There is no additional charge which the employees will have to pay. Here, what we have integrated it with MFine. So we believe we are no expert in this in getting the doctors empaneled. So we have simply tied up with MFine. So with this link, you will have access to all the doctors at MFine. What we have brought to the table is that the GP consultation for all your employees will be free. So that's why you can see here on the screen visible that Dr. Anup Trivedi, who is the and if you click on the consult now button, you will be getting an appointment with this doctor in the next 30 to 45 minutes. I'm not clicking because that will straight away take me to the appointment. So why this doctor consultation also very relevant? As I told you, after the advent, a lot of people were skeptical to go to the healthcare centers for common infections or virals or cold and cough. For two reasons, of course, because of the issue of infection and also They didn't want it to go because of the huge time also taken. So here with this accessibility, now people can consult with doctors. So this may not look or sound great for a city like Mumbai, but especially if their dependents are staying at far off locations and they don't have immediate access to doctors and also specialists in those areas, with this app in next 30 minutes they will be able to use this app and avail the doctor facility. Not only this, the other areas where we have felt the need for this and people have used it is if you want to go for a mental counseling session related to mental health issues. People, again, mental health is considered as a taboo, and people are not comfortable going to a healthcare center directly. So here, with this access, you can talk on your mental health issues with a mental counselor. Similarly, as I told you, for if some dependents who are at remote off locations who don't have immediate access, that also can be availed. So these are the few unique benefits of doctor consultations. In fact, doctor consultation, once you take the consultation, the doctor will ask you a few questions on symptoms, what you're facing, and based on that, he will upload a prescription for you. And this prescription, in turn, once it is uploaded, you can also have the option to order the medicines online, and the medicines will be delivered to your place in the next 3 to 4 hours. So this is the kind of integration which we are bringing on the platform, where the employees have access to immediate OPD benefits, doctor consultations, and so pharmacy may, as I told you, we have integrated with 1mg. Okay, so you'll have to do a login here. I'm not doing a login, but as I told you here, 1mg, and these are minimum 20% discounted. In some cases, it can go up to 25% also. So here we are also able to save on the healthcare costs for the employees if they wish to avail this facility. Right. Again, going back to the app, we have also integrated health checkup packages. Where if an employee wishes to avail health checkup packages for himself or their family members, there's a host of health checkup packages available on this platform through PharmEasy, and these are again discounted 30 to 35% if you go through the app. So again, what we have tried to empanel them, we have tried to discount, because 5 lakh people, 50,000 people are currently using this application. And because of the kind of volumes we are showing to these service providers, we are able to avail better discount than an individual HR or a company negotiating with these platforms. Right. Now I take you to the next aspect. Okay, there's another poll shootout. What kind of wellness webinars would you like to conduct for employees? Right. So as we are going ahead with the wellness zone, here are the options: lifestyle management, WHO Global Health Days, yoga sessions, mental health counseling. Please participate and do let us know. Your feedback is very important for us. This will help us develop products or improve existing offerings which we are already giving through this platform. So we are showing is a live platform. Okay, this is not a PPT presentation. On December 2, upcoming December 2, we have a session on winter skin and hair care tips from Dr. Avni Manya. So as I told you, again, in wellness, we were doing a lot of offsite sessions. Okay, the poll results are out. Mental health counseling. Okay. Thank you so much. I think especially after the advent of the COVID, and because of the work from home culture also, there's a lot of employees who are there's a lot of HRs also who are coming up whether you can hold such sessions. So here we are doing such sessions through Mantra, which is a service provider for these mental wellness sessions, where individually employees can do one-to-one counseling sessions also. Okay, now coming back to so there's also a dossier of past events which we have done is also uploaded. So in case some of the employees, so how does it work? Once the employee registers on the platform, once the data comes to us from the HR for their mobile number and email ID, and we integrated them in the platform, there's a welcome emailer which goes to all the employees on their official email ID. Once they register through their email ID, they get access to the app, and the app also has a wellness tab. In the wellness tab, they get whenever the sessions are conducted, at least 10 days in advance, an email is sent to all the employees. The employees, once they register on those links, then they get access to participations, and also reminders are sent. So in the past, we have done sessions on dietary and diabetes management, similarly for hypertensions, for skin and hair. Omicron was done in the month of July, and so on and so forth. So even, in fact, we have also done sessions on financial management for employees, especially we do it in February and December for tax management. So these are the sessions which are conducted. Again, here it is Unwind with Music by Richa. So this was again a very beautiful session here. So here we get the best person in the discipline. These are individual professionals who have their own practices, and we ask them to come on platform and do sessions for our employees through coordination with them. Right. Now, after the healthcare integration, I come to the last part of the offering, which is the flexi policies. So what are these flexi policies? Right, again, a poll coming in. What is the most common request HR gets from the employees for flexi? So flexi is basically, most of the times we have heard from HR that there's a request from the employees for additional sum insured, or maybe the company is offering a self-only policy, whether we can add spouse, child, or maybe even parents into the policy. And most of the time the answer is no, because the sponsored programs where the management come with limited budget and cannot be extended beyond a certain limit or certain definition. But here, in case if you wish to avail, please participate in the poll request for increase in sum insured, and let us have your feedback. So here I take you through. Here there's a tab, I think, which you can view, which is saying get a super top up of 20 lakhs starting at 595 per year. In case if an employee wants to increase the sum insured, the management company is giving a 3 lakh sum insured. He wants to buy an additional 7 lakh sum insured for himself and his family members. They can do it by just clicking on the link here, and they can avail this additional benefit, which will be running independent of the main policy. There will be no impact on the individual. It will be an individual group top-up policy for the individual, and any claim impact of the additional sum insured and the claims under the policy will have no or zero impact on the base policy, so that both of the policies claims can be monitored individually. Right. Similarly, as I told you, we can do it for OPD cases, also for parental cover. But OPD is still not structured in India because of the because insurance companies have seen a lot of frauds there. But yes, we can try and integrate that as well. Right. Now with this, I come to the end of the healthcare and the flexi policies integration. I think, Pratik, we are open to take the question and answer sessions. If you have any question and answers, you feel, yes, we've got few questions here. In fact, a lot of questions here. And in the advantage of the time, I will take a couple of questions, and then I'll take it to vote for thanks from Monica. Okay, so Pratik spoke about enrollment in the policy. This app also allows you to do addition, deletion. You can upload your Excel. So there's a query from one of the HR which is asking from Mr. Vijay, is there any particular format for enrollment data to upload on the system? Yes, so there is an enrollment format which is available on the app itself, on the portal, which you have to download, accessible only to HR. And you will have to fill up the data, and you can just upload it. If you upload the data, you will get to know what is the calculation of the premium, and at the same time you will be able, because you know the calculation, you will be able to know whether the amount is adequate enough in the CD balance to take care of that endorsement. Okay, so yes, there is an enrollment format on an Excel sheet, in which format only you need to upload the data. There's another question from one of the HR. Will I get a consultation letter online after my consultation? Okay, this is coming from Mr. Yogesh. Yes, once you take a doctor consultation online through the app, and once you have given all the symptoms to the told the symptoms to the doctor, and the doctor is sure on the prescription, so once he prescribes you medicines, that copy of prescription will be uploaded on the app itself, which again can be used to order medicines online, or maybe you can buy at a shop which is convenient or near to you. Yes, the doctor prescription will also be uploaded same time online. In fact, the follow-up consultation would be free. So normally what happens is, if it is a viral and the doctor has given a prescription and the medicines for the next 5-7 days, after the 7th day or 5th day, whichever the doctor must have integrate put it in the system, the follow-up is free. There's no charge. Any which way, the first GP consultation is also free. So there's no challenge here. So again, there's a lot of question. Can family members also avail for pharmacy discount? Yes, you can avail pharmacy discount integrated for family members also. Fortunately, irrespective of whether the family member is added into the policy or not, you can still go and avail the pharmacy discount. Is the top-up policy same as the base policy? Yes, what we have tried doing here is we have tried to integrate the benefits of the top-up policy and the base policy, so that there's a seamless seamless issuance of coverage under the policy. And yes, all the waiting periods under the group top-up policies have also been waived off. Right. Any more questions? Yes, we've got a couple of more questions here. Pratik, you would like to take a couple of questions here, please?
Yeah, sure. So basically, one question is coming up. If it shows doctor near you, is it specific to employee as well? So whoever the employee is trying to check the doctor's availability, it will show you the doctor's availability to the vicinity from where the employee is operating. So for example, he is in the office, his office in Andheri. So it will show him where the mobile is, and it will show the current certain kilometers within that range. Doctors will be available, which doctor is available. And secondly, if he's at home, maybe he's staying in Thane, so the doctors from Thane area will be displayed to him. Second, there is does the app update real-time claim status? Yes. Does the app user data claim status real time? So
I would like to add here, Pratik, as I told you at the inception, we are bringing the TPA, the insurance company, and the broker on single platform. We have done API integration with the service providers who are handling claims settlement, like the TPA. And because we have got access through the API integration, we've got real-time access on the claims, and which is displayed also on the platform. So this is now live for 6 TPAs and almost 8 insurance companies. But as we are working closely with insurers, more and more insurance companies and TPAs we are trying to integrate. There's one more question here. In case of a top-up, can corporate and top-up be clubbed if the corporate cover is not sufficient? So all group policies or health insurance policies, for that matter, individual or group, come with a contribution clause. Contribution clause talks about, in case if the primary policy is exhausted, yes, the secondary policy, whichever is available, can also contribute to the claim. So if there's a claim, if you have got a company cover of 3 lakh, and if you have an additional 7 lakh, and if you've got a claim of 10 lakh, yes, 3 plus 7 is the amount which will be paid under the policy as a claim. Right. So with this, I would like to take the step forward. In fact, one communication here to all the, so as we have developed this app, we would like you to use this. We would like to, we are inviting that please, what is required to get this started? So we require the data and in the data we would require, of course, the email IDs and mobile numbers. So once you have given this, and if the policy is with us, we can, with this mobile number and email ID, we will be able to onboard the data on these platform, and all your employees will get a welcome emailer. Once they get a welcome emailer and once they click and register themselves, they'll be able to use this app. So for more participation, and if you really like the way this platform is running, a lot of people are using it. It's a great engagement tool. It is intending to solve not only the hospitalization challenges which was there earlier, the communication, the transparency, the real-time basis feedbacks to the employees, but also as we are trying to integrate the primary layer of healthcare. I would request all of you to use how the maximum possible, and for this you can help us by providing us the data with email IDs and mobile numbers, and once you give us those requests, we will be able to integrate on the platform. Right. So with this, I think, Pradeep, if we are done, we propose a vote of thanks. I invite Monica here to propose a vote of thanks, and then we can call the session off. Thanks, Monica. Over to you.
Thank you, Pramod sir and Prateek sir, for lining up this session. And also would like to thank all the participants to giving their valuable time and attending the session over a weekend. Hope this session was very informative, educative, and has given you a lot of understanding about how the new product has been designed. There were few questions which were answered, but due to time constraint, there may be few left out, or some may come up on later stage. So here we would be more than happy to answer them over a call, and if required, we can meet up in a personal and answer them. Once again, on behalf of insurancemanager.com, we thank all the attendees and look forward to connect with you on the same. Thank you so much.
Thank you very much, everyone. Thanks.
Thank you for joining us on a Saturday. We hope we have tried our best to enrich you. The idea of these knowledge sharing sessions are to imbibe knowledge to our decision makers in HR and finance, so that they can take informed decision making related to risk management and new benefits available in insurance in the Indian market. Thank you so much.
Thank you very much.